Uganda has struggled with access to sexual reproductive health services. It is only just enough to note that, amidst the challenges in accessibility, it has taken the country a long time to achieve some success. The contraceptive prevalence rate has risen from 18% in 2006 to 35% in 2016, with a target being 50% by the end of 2020. However, as the pandemic rages, more women are unable to access family planning. They face unintended pregnancies and gender-based violence, among other harmful practices.
A relapse and failure to address the above may lead to a rise in maternal and newborn morbidity and mortality.
According to projections by UNFPA, more than 47 million women could lose access to contraception, leading to 7 million unintended pregnancies in the coming months.
After the lockdown was imposed on 31st March, many people could not access many essential services due to public transport restrictions. Health experts are worried about a catastrophic development if sexual reproductive health services do not become more accessible sooner.
So there's a huge gap now where we were kind of like streamlined and moving forward with sexual reproductive health. We are now slowing down and drastically. And I must add, there is a lockdown, yes, and a very much needed lockdown. But then one thing we have to realize is that sex has no lockdown.
A look into many of the pharmacies which were sampled around Kampala and its suburbs shows that these products and services were last sold in March. They predict a bigger problem if the matter is not handled immediately.
If this continues, there's going to be an increase in unwanted pregnancies. That is the honest truth, because young people are having sex left, right, and center, and majority of them are not being protected. So that is one. Two, there'll be a lot of incest.
The woman has to seek sometimes the permission of the man to walk, because men are also no longer trusting their women to walk on foot somewhere to access healthy reproductive services. So this has made decision making very, very difficult, and as such, it sometimes have increased the risk of mortality and mobility, especially in terms of women. And it's important that with me 9 months from now, the population of East Africa will be 200 million from 160.
Dr. Joyce Moriku, the Minister for Primary Health Care, has urged couples to labor and seek access to these services.
This is not the time for the young people to get engaged into sexual activities. They're asking for condoms, they're asking for contraceptive. I'm telling them, abstain.
The country representative of United Nations Sexual and Reproductive Health Agency says they understand the urgent need of these services and are working to ensure that they are brought closer to the people.
We've started to work with Safe Border to make available different kind of contraceptives, condoms and others, so that they will be transported.
The talk is that if the situation is not handled, then a baby boom and a rise in population is expected in the near future. Olivia Komgisha, NTV News.